cholesterol is essential for all of us.
Yeah.
But the only time when it's an issue is when there's too much of like the bad cholesterol, which can
Yeah.
lead to
The symptoms with cholesterol are not visible, with high cholesterol are not visible.
mm,
It's often, as that's why we said it is a silent condition, it's a silent
yes.
threat. Some people are like, what is so bad about the bad cholesterol?
Mm,
You know, like, what is it? Because if you think about it, people think bad cholesterol or associate bad cholesterol with just weight, but that's not
mm,
even it.
no,
You know, that's why we said
yeah,
there's not really a symptom. You can't just look at someone and
no.
say, oh, you have high cholesterol, you know.
Welcome to Consultation Room Podcast.
Welcome to another episode. Now, high cholesterol, as we know it, is often something that is called a silent threat because we know that it sneaks up without symptoms until it's too late. But don't you worry, we've got you covered today, because in this episode, we are going to break down what cholesterol really is, why too much of it can be dangerous, and most importantly, how you can take control before it takes control of you. So we will talk about some diet hacks and also lifestyle tweaks that we're going to give you to ultimately guide you in keeping your heart happy and your
Yep.
arteries clear. So let's dive right into it.
Mhm.
So, Steph, what exactly is cholesterol? What is high cholesterol? Like, what is the definition of these things?
Brilliant. So, cholesterol, to start off with, is something that we all have. Okay, so it's a waxy fat-like substance found in our blood. Cholesterol is usually made from the liver, or sometimes it's actually absorbed from like the food we eat. So we actually need cholesterol. So not all cholesterol are bad. We need cholesterol to actually help build the cells in us, to make some hormones, to produce some vitamin D. But the only time it becomes an issue is when there's too much of it. And too much can lead to serious health issues. But there are different types of cholesterol. So let's break it down. We have some where we call good cholesterol, and we have some where we call bad cholesterol. So I'll start off with the good ones. So the good cholesterol is something we call HDL, which is high density lipoprotein. So this is when we say the good cholesterol, it helps remove excess cholesterol from like our bloodstream. So this actually takes the cholesterol back to the liver where it is broken down, and it is removed from your body. So thereby it keeps like your your arteries clear and it's not blocked. And then we have the bad cholesterol called the non-HDL, which is the non-high density lipoprotein. So too much of this can actually cause like a buildup of plaques in the arteries, and this is when it leads to like heart diseases. So I'm sure some of you have also heard of LDL. So before, this actually used to be like the main measure for the harmful cholesterol, but then they found out that there's other forms of non-HDLs which are harmful to us. So when you do go for like testing, they will do something called a lipid profile, and they usually measure these types of cholesterol. There's also another one I need to talk about, which is called triglycerides, if you're talking about high cholesterol, because triglycerides are actually a type of fat in your blood that can also contribute to like narrowed arteries and heart diseases. So all in all, high cholesterol is basically when you have too much of cholesterol in your bloodstream. So we can go into like the diagnosis, and we'll talk about like the diagnosis and talk about maybe the levels of some of these and what we should aim as a healthy healthy adults. So I don't know if you want to go through that, Trudy. Should we mention the diagnosis? And then we could talk about like the causes later.
Okay, I think before we mention the diagnosis, it's very, we always talk about symptoms. With most of the conditions, talk about symptoms. So I think it's worth talking about something to look out for when it comes to high cholesterol, which, to be fair, is nothing.
Yes.
So the symptoms with cholesterol are not visible, with high cholesterol are not visible. It's often, that's why we said it is a silent condition. It's a silent threat. And maybe you might get diagnosed because of other things. So you might go to the doctors maybe for your regular checks, and they will check your bloods, and then they will check your lipid profile, and that's when they'll say, oh, you do have high cholesterol. Or maybe someone might suffer from stroke or maybe even a heart attack, and then that's when they will find out that maybe you have high cholesterol. So there isn't exactly one symptom that you can look out for to see if you have high cholesterol or not, or low cholesterol. The only sure way I normally say is, once you've reached 20, 25, get that regular test, get that regular check, just to make sure that you know your cholesterol levels, if you have high cholesterol or if you have low cholesterol. Now, generally, the number normally they look at is, again, this is a very general rule. It's normally about sort of 130 to 160, is it? And this is for sort of like borderline high. So after this, maybe your doctors might consider some treatment. But I always say everyone's levels will be very tailored to them, and some people might have very high levels and then they might not necessarily be on any medication, whereas some people might have lower levels and they might want to be put on certain medication, depending of course with other factors that would add on to to play to this sort of high cholesterol. Unless there's anything you want to add, Steph.
Yeah, so when it comes to diagnosing and testing, we normally say ask a GP. If you've not had like a test before and you're over 40, overweight, or high cholesterol or heart diseases runs in your family, make sure you ask your GP so that they will like run a test for you. So the test that the GP might run is usually a blood test, and then you could also get some tests done in like Pharmacist, which is like a finger prick test, and maybe during your NHS health check as well, you can get that done. When it comes to the diagnosis, yes, Trudy is right. It all depends on the type of individual there is. So every individual really, your lipid profile really varies. But in like a healthy adult, yes, we are aiming, like there is a guide out there to help us basically like reach a diagnosis. So if you are a healthy individual with like maybe no heart diseases like such as like stroke or heart attack, so they'll normally check like your total cholesterol, which they normally aim for like less than 5 millimole per liter, and then they'll look at like maybe your HDL as well. And they'll also look at your non-HDLs as well. Sometimes depending on what sort of harmful cholesterol there is, or what sort of like family you're from, they might look at your LDL, which I did mention. So but what I did actually want to touch on is that if, let's say for instance, you have some type of like heart disease such as stroke going on, like Trudy mentioned, your cholesterol levels may differ from like a healthy adult. So like your target, they will aim for a lower cholesterol level for you as compared to a healthy adult. So that's something that we may have to put that into consideration. Yeah, so that's really it about like the diagnosis and testing. Each like it really does vary, as Trudy mentioned. Yeah.
There is something you mentioned though, and I think I just want to add to it, which is to do with sort of the bad cholesterol.
Yes.
We just very quickly sort of mentioned what the bad cholesterol does and why is it considered bad? Why, like, what does it do to save the body for it to be considered bad? You know, because okay, so we've talked about stroke and we've talked about heart attack, but what does the bad cholesterol actually do? Because I mean, there is the good cholesterol, which we now know what it does. So it helps. You've mentioned this. It helps sort of like retain or move the bad cholesterol through the liver for it to be sort of excreted. But then the bad cholesterol, if the bad cholesterol is still, you know, is accumulating in the body, it might narrow your arteries, it might limit blood flow to the tissues and other organs, and even raise your risk of blood clots. Hence why stroke and heart attack would probably be something that would come as a byproduct of this. That's why we need to look at lowering this bad cholesterol. I think that's just worth mentioning, because let's be honest, some people are like, what is so bad about the bad cholesterol? You know, like, what is it? Because if you think about it, people think bad cholesterol or associate bad cholesterol with just weight, but that's not even it.
No.
You know, that's why we say there's not really a symptom. You can't just look at someone and say, oh, you have high cholesterol. You know, maybe they're a little bit bigger and you're like, yeah, you've got high cholesterol. They might not even have high cholesterol. Maybe there's genetics that's playing a part into like their weight or anything like that. But someone else might look very healthy, very lean, and then you might be like, okay, you have very low cholesterol, and chances are they probably don't. They have high cholesterol. So it's not really something that you can see, but it's whatever it does to the body that is considered bad cholesterol. And of course, complications of this sort of accumulation of bad cholesterol is things like now the stroke, the heart attack, high blood pressure, and things like that. You did mention something in passing, which is causes. So what could be a cause for bad cholesterol?
Okay. I think I'll put the causes and risk factors together only because we might be repeating ourselves. So as I said, as we've said earlier, anyone can develop high cholesterol. Yeah. Whether you're young, old, thin, fat, anyone, it does not discriminate. But it can be caused by different things. Some I would classify that some you can control and some you cannot control. And that's what I would put it as. So I'll start off with like some of the things you can control. So one, which we always say, is poor diet. When it comes to a lot of things to do with heart, poor diet is like number one. So maybe you're eating too much of like saturated fats, trans fat, like your diet is unhealthy. So these lead to basically a buildup of the bad cholesterol, and which will result in like what Trudy said, all these health issues, you know. So poor diet is number one for me. Also, lack of exercise. So one thing people don't actually know is physical activity helps boost your good cholesterol. So lack of exercise, it will result in you basically not having a lot of these good cholesterol and more of like the bad cholesterol. So yeah, that's why I said I'm grouping them in things you can control. All of these things we can control, so you know what to do. Yes. And the next I would also put is smoking. So smoking, yes, can lead to high cholesterol levels, and it actually causes you know, the tar to build up in your arteries, making it easier for cholesterol to stick to your artery walls, therefore leading to health risk. So
that's it.
yes, these are like the main ones I feel like we can control. Alcohol as well is also a risk factor. Obviously, do stick to like the requirement if you can, but that's also a risk factor. Things that I would say we cannot control, I will put age. You know, as we said, like everybody has cholesterol in them. Even young people have cholesterol. But with age, I feel like the older you get, obviously, because the liver makes the cholesterol as well. Sometimes, yes, when you grow older, the liver kind of yeah, it kind of reduces. So the function of it reduces, therefore reducing the amount of good cholesterol as well. And yeah, so age plays a role. I would also put biological sex. It has been found that those assigned male at birth are more at risk of getting high cholesterol.
Yeah.
We don't know why, but it is out there. Ethnic background as well plays a major role. Yeah, it is a
Yeah.
risk factor as well. Genetics, unfortunately, there are some people who inherit high cholesterol. So this is not their fault. This is when they actually have like something wrong with their genes produced, like where they're not able to produce like good cholesterol and get rid of the bad cholesterol very well. So this is not their fault at all. It's something that they
Yeah.
cannot control. Yes. And the name for this is actually called familial hypercholesterolemia. That is
Yeah.
what the genetics one is called. Yes. And other causes as well for high cholesterol may include health conditions. So this may include like diabetes,
Yeah.
also the likes of like hypothyroidism, kidney disease, even liver disease as well.
Yeah.
There was something actually I also put, I was like borderline something you can not control and can control, so which is obesity. So I was kind of
I
in
think that's
between. I'm like,
controllable. I think
you know,
because obesity comes with overweight,
I
right? Like
know.
overweightness.
Yes.
So we always say, I think that is something you can control because if
I
you tackle
know.
that, you see what I mean? If you
I know.
because you
But
can
what if
tackle
somebody
that.
cannot help it? Like, So I was like
Because
in
that is something you
between.
can do something about. But something like diabetes, you can't do nothing about. If you've got diabetes, you've got diabetes.
Yeah.
If you've,
I
you've
was trying
got
to get I was trying to be a bit softer, not too harsh. I was like,
okay, be
I'll put it
subtle.
in between, Yes.
Yes.
Yes. So obesity as well is linked to risk of like high cholesterol. Yes.
That's
So
it.
yes, these are like the main ones that we put, but all in all, these like the cause of like high cholesterol is basically when you have high amounts of like the bad cholesterol in your blood systems. Yeah.
Yeah. Okay.
Brilliant.
I'd like to just add one more group, which is actually postmenopausal women.
Okay.
So postmenopausal women actually see that they have a drop in their good cholesterol, which is the HDL. And as we mentioned earlier, is what we mentioned earlier is the HDL actually works against the LDL, which is the bad
Yes.
cholesterol, by sort of like helping its removal in the liver. So if you have a reduction in your HDL, there won't be as much of that LDL being removed. And that unfortunately happens in postmenopausal women. We don't understand why this happens. It's just once you get to that age as a woman, your high cholesterol, high density lipoprotein, which is a HDL, the good cholesterol reduces, which kind of like creeps up the bad cholesterol. So that is one group that we also know does we also know will maybe experience high cholesterol. And you did mention men and women, but I'd also like just to add that normally it's men over 45 and mainly women over 55. So again, for women, luckily we are a bit, we still have a good 10 years until we have that creeping high cholesterol. But unfortunately, with increase of age, there is a chance of increase of that bad cholesterol.
Yes.
Yeah.
Brilliant. So we've been through like the causes and risk factors. I think using this could you please provide us with some preventions people can take?
Okay. So as we have said, most of the things that would contribute to an increase in your bad cholesterol, you can they're modifiable. So you can modify these things and that will maybe prevent you from actually having bad cholesterol. So when it comes to like, say, diet, just eating a low cholesterol meal you know. So as you said, Steph, avoiding the saturated fats, the trans fats, and also just eating low cholesterol foods, that would actually help in preventing high cholesterol.
Yep.
And some of these foods are even things that you don't think about, and it's like every day, like you eat these things on a daily basis and you're like, this is good. So a lot of people eat red meat, and the red meat can actually have high cholesterol, but you could say, oh, you're eating your red meat and your veggies, so you're fine. No, if you're eating your red meat, which has high cholesterol, maybe you're actually picking vegetables that have high cholesterol, you're actually increasing your likelihood of having high cholesterol. So it's just about maybe knowing the foods that have low cholesterol, and then maybe implementing this in your daily sort of meals, so that can actually help prevent high cholesterol. As you said, of course, avoiding excess alcohol consumption. So we always talk about the units, for men and women. So sticking to these units, which is 14 for men and 10 for women. So this unit is very, very important. So sticking to this unit, and that's per week. Sticking to this unit is very, very important. I always say, if you can even go lower than your regular units, this will actually prevent you from having high cholesterol. And sometimes when I've spoken to some of my patients in clinics, and I say to the men, so how many units of alcohol do you drink in a week? And they say, oh, don't be silly. I drink whenever I want. I don't have any problems. And I look at their medication history. I'm like, okay, you're on anti-cholesterol medication and you think you don't have a problem? So I think people associate alcohol with maybe like the worst of the condition. So like, liver failure and things like that. You don't realize that there's other things along the way that's actually contributing to that really, the worst of the worst, if you know what I mean. So things like this could actually just prevent you from taking that extra tablet that you're taking. But avoiding excess alcohol consumption is actually one of the ways of preventing high cholesterol. And as you said, Steph, one of the things as well is if you don't exercise. So exercising regularly is actually really, really important in preventing high cholesterol. So we always say 30 minutes a day is good, even if it's just 5 days a week. So that 30 minutes of walking a day, again, we're not, it's not leisure walk. You walk for 5 minutes, you stop, you watch the birds fly, and then you keep going. No. Just make sure you put aside 30 minutes of walking every day. Maybe 5 days a week. That is enough to just keep you going. But yes, regular exercise is actually very, very important in preventing high cholesterol. And also maybe if you smoking cessation. So we have talked about smoking in the past. We've talked about ways to stop smoking. So maybe getting on these programs, if you already smoke, could actually prevent you from having high cholesterol in the future. And of course, if you don't smoke, but maybe you're a secondhand smoker, maybe also look into this, because we always say sometimes even secondhand smoking might be even worse than you smoking. So just trying to avoid some of the things that you can avoid would actually help prevent high cholesterol. Unless there's anything I've missed, Steph, any other pointers you have to prevent high cholesterol?
No, one thing I would just add in there, just go for regular checkups, because as Trudy mentioned, there's no symptoms, like you will not feel that you have high cholesterol. So the best way to prevent it is basically to go for regular checkups. That's the one thing I would add to that. Brilliant.
I'd just like to add, whilst we're on it, when it comes to, say, the foods, because you've said avoid foods that have high cholesterol, I think it's just worth mentioning some of the foods that actually have high cholesterol, because it's pointless for us to say avoid these foods, but we're not saying which kind of foods. So some of the foods that we have on a daily basis could actually be having a lot of high cholesterol. And as I've said, red meat, unfortunately, guys, I know you like your beef, I know you like your red meat. I'm not saying cut it out completely, but maybe reduce how often you actually eat some of these foods. So maybe once a week, or maximum twice a week, that should be enough to just maybe reduce the amount of high cholesterol you're ingesting. But red meat, unfortunately, does have quite a good, quite a high cholesterol. and even egg yolks. So if you love your eggs, Ghanaians, if you love your eggs, like Ghanaians, maybe not having too much of the egg yolks, that can actually help reduce your high cholesterol. Again, they also that is the best part of the egg. And I listen, I've been there, okay, so I understand. But this, if you maybe reduce how often you eat some of these things, again, that is going to help. Another thing that also has very high cholesterol is high fat dairy products. So if you have your blue milks, the whole milk, your whole life milk, is it whole milk?
Whole milk. Yes.
Yeah, whole milk. Yeah. So you have your blue bottle milk,
yes.
or you have your really rich cheese, and just foods that's very high in dairy. Fat dairy. These can actually also have very high cholesterol. So avoiding some of these foods as well, that could actually help lower your cholesterol. And also any extremely processed foods. Unfortunately, also foods that are made with cocoa butter or palm oil. So, and I know this for sure because I live this lifestyle where unfortunately some of my family members cook with palm oil, and I try to avoid palm oil, because again, it actually has quite high cholesterol, and that could be clogging your arteries. So again, I'm not saying cut it out completely, but not using some of those products as often as you do, maybe to cook and things like that. That could actually help. And also deep fried foods. So I know Fridays normally is fish and chips Fridays, but having that your battered fish, which is so nice, every Friday, and it has been deep fried, and maybe doing that quite on a regular basis, that could actually be what is going to eventually cause you to have high cholesterol. So maybe cutting down on some of these things would actually help. And also certain baked foods, like some cookies and some muffins, they do also, or they can contain quite a high cholesterol level. So reducing how often you eat some of these foods, or maybe reducing the high cholesterol ingredients you add to some of these things could actually help reduce your high cholesterol. They do say that fish is very, very good for you. And honestly, fish and other omega-3 fatty acids do actually help lower your bad cholesterol. So maybe you can replace your red meat with some fish, or even some omega-3 fatty acid foods, whatever it is that you like, that is, that has omega-3 fatty acid, that could actually help replace some of the high cholesterol foods.
Brilliant.
Now, when it comes to treatment, Steph, what are we looking at?
Brilliant. So let's say, for instance, you've gone for your blood test and a doctor has rung you up, or a nurse, any healthcare provider has rung you up. So what normally happens is that they may actually work out your risk of having like a heart attack or stroke in the next 10 years. And sometimes this will actually prompt them as to how to treat you. And I'll start off with one. So we mentioned prevention. So I'll mention something called primary prevention. So primary prevention is when, for instance, you do not have any cardiovascular diseases, but you are at risk of getting a heart attack or stroke in the future because, like, your cholesterol is high. Yes, blah, blah, blah. So when this happens, the first line of treatment for anybody that has high cholesterol is lifestyle changes, which we've already mentioned when it comes to like the prevention. So lifestyle changes, that's in your diet, exercise, smoking, all of that, make changes to that. So these actually helps lower your cholesterol naturally. So that is the first line any healthcarer would talk to you about, is to target your lifestyle. And then If lifestyle changes are not working, then we will start talking about medications. So the choice of medications or combinations of medication actually depends on various factors, including like
Yeah.
your personal risk factors, your age, your health, and possible drug side effects as well. So you could be like, just because one person is on a medication doesn't mean that you be on the same medication. Let's put it out there. That's what I'm trying to say. Yeah. But let's name some of the common medications that you might find people on. So I have mentioned with primary, start off with with lifestyle changes, but with secondary prevention, this is when like let's say for instance someone has like some underlying heart diseases such as a heart attack or stroke. This is when you have to start the person on the medication. So the medication which you may see people on, which I'm so sure like is so common in every household, is a statin. So statins such as like atorvastatin, which people also know it as Lipitor. So these medications are actually medications that help block a substance in your liver to make cholesterol. So they cause your liver to remove cholesterol, so thereby
Yeah.
lowering your cholesterol levels. So you take one a day, depending on which medication it is. It might be atorvastatin, as I mentioned, or simvastatin, or rosuvastatin. There's so many, but it's mostly taking one a day. Do check which one you're taking. There are some where you have to take, it's fine to take during the day, others you have to take at night. Unfortunately, you usually have to take this medication for life. And yes, and then when it comes to the primary prevention, let's say for instance, if you don't have any underlying cardiovascular diseases, you start off with a low dose of like the atorvastatin. And if it is secondary prevention, if you do have other underlying cardiovascular diseases, they do start you straight up on a high dose of atorvastatin. Yes. And so if you are someone that is, they do start you on a statin, you will go for a blood test beforehand, 3 months after, and when you're on the medication as well. So the reason for this is that sometimes it may cause some side effects, and we do need to monitor your liver as well, because it works on the liver and it does cause some side effects on the liver. So it may cause like elevated serum transaminases, and we normally keep an eye on this. If it is 3 times more than your usual one, we will normally stop you on the statin just to monitor it or change it to something else. And the most commonly reported side effects when it comes to statin is myalgia. So we normally advise patients, if you are on statin and you experience any muscle pain, tenderness, or weaknesses, please seek for medical advice. So that we can advise you on what to do next. There is a rare side effect of it causing rhabdomyolysis. This is like when it causes like muscle waste and stuff, but this is so rare. And in any cases, we always monitor your blood test, always monitor your bloods, so we'll be able to catch anything if possible. So statins are literally like the main ones that you see patients on. There are other medications as well, which are available if, let's say for instance, you're intolerant to statins, or if if like the bad cholesterol are not being lowered to your target levels. So you may find out that there are the likes of like ezetimibe, which is a cholesterol absorption inhibitor. So this helps reduce the absorption of cholesterol, as it says, by limiting like the absorption of like the dietary cholesterol, basically. So ezetimibe. So you may find some patients on like a combination of like the ezetimibe and a statin. Which is also common. There is something as well, another medication which works very similar to statins, which is called bempedoic acid.
Yeah.
And these, as I said, work very similar to statins, but the only difference with that, they are less likely to cause muscle pain. So
Mhm.
it's favorable, as you can see,
Yeah.
because of the less side effects. Other medications also include bile acid binding resins. So
Mhm.
these include like cholestyramine, cholesevelam, and they actually bind. What they do, as the name suggests, basically liver uses cholesterol to make bile acids, and these lower cholesterol indirectly by binding to the bile acids. So once they
Yeah.
do that, they promote like your liver to use excess cholesterol to make more bile acids, therefore like reducing your
Yeah.
cholesterol. And then we have another medications also called fibrates, which is quite
Yeah.
common as well. So these reduce like your liver production of like the very low density lipoprotein cholesterol. And they also speed up the removal of triglycerides from your blood. And another medications, which is quite new, are injections. And these injectables are actually usually given to those with the familial hypercholesterolemia. So these are the ones that are caused by like genetics.
Genetics.
Yes. So that's when you will find people like using the injections. There are other medications as well, such as omega-3 fatty acid supplements and like nicotinic acid. You don't
Mhm.
often see people on these medications. They're rarely used.
Yeah.
Yeah, they're like literally at the bottom, but you
Oh,
may be, yeah, you may
yeah.
be on them, yeah. But the most common, as I said, is the statin. That is like the main
Statins.
treatment for cholesterol. Yeah.
Yeah. I think
Yeah.
with the when it comes to some of the other medications that you've mentioned as well,
Mm,
they might not necessarily be used because they
mm-mm.
would not be considered as first line, as you said. So
No.
bempedoic is also not necessarily first line. Part of it
No.
is because statins are first line. So
Yes.
even though they have less of the side effects compared to statins,
Mm-hmm.
you would probably be put on statins before you're put on something like
Yes.
bempedoic acid, unless you can't tolerate a statin.
Yes.
Then you might be put onto these other ones. Hence
Yeah.
why the other ones might not be that popular. So
Popular.
the reason
Yes.
I say that is a lot of times, especially when patients have say muscle pain, they're constantly like, oh, what can I get as an alternative? The thing with side effects, as we always say, is with time they will wear off. So with time, a
Yeah.
lot of the patients who actually are on statins, with time they say, yeah, I did have muscle pain initially, and it
Yeah.
just sort of like I tolerated it and it wore off
Yeah.
and I was fine. So you don't want to be put on something that's not first line just because of a side effect that you're getting, unless you can't tolerate the first line.
That's right. That's right. And another thing I wanted to avoid, which I wanted to add on, which we always advise patients when they're on statin as well, is to avoid grapefruit juice. We always tell patients it's
Yes.
only because it increases your
Yes.
risk of side effects as well. Yeah.
Exactly.
Yeah. And anyways, before you start any medications, pharmacists and doctors will go through all these points with you just to check that there's no interactions as well with your other medications, and they'll advise you accordingly as to how to
Yeah.
take them. Yeah. So is there anything to add or any myths out there, or any misconceptions you want
I
to
think the
first?
myths, we've kind of talked about some things
Yeah.
along the way that could maybe have clarified some of the myths, which
Yeah.
is things like, if I am healthy, if I am doing XYZ, then I shouldn't have high cholesterol. But we
Yeah.
have gone ahead to kind of like debunk this along the way by
Yes.
saying sometimes, even things like genetics, you could be healthy, you could be working out, you could not even be
Yeah.
drinking, no smoking, but then genetics might play a
Play
role
it
in
well.
actually
Yeah.
causing you to have high cholesterol. So I think along the way we have kind of debunked the myths
Yes.
without even, realizing it.
Yeah.
But of course, I always say, if you have any myths or if you have any questions, you can always add on, and then
Yeah.
we can kind of like go through this maybe in the comment section. question or drop us a DM, and we can always talk through this. But I personally don't have any myths that, that I would want to kind of like go through, because we could kind of like talked about everything.
Yes.
Yeah.
Brilliant. Okay.
One thing I'm going to add though is we do like home remedies, and Steph, you like your home remedies.
Yeah.
So again, this might be a myth. This might be, efficient. It might be working. Listen, if you've tried these things, please let us know in the comment section. Drop us a DM. Let us know if they're working. But just with sort of like talking to patients, sometimes they say that they have tried some things. They've tried to implement some things alongside maybe their medication, or whilst they were on that initial plan, medication plan, which is exercise, diet, and all of that. Some patients have said that they've tried some things just to help reduce their cholesterol. Now, again, there's not been any studies that's been done about this. I'm not saying that these things work, but this is some of the things that I've heard that patients have actually said that they try. So some patients claim that garlic actually helps lower their cholesterol, their high cholesterol, which is bad cholesterol. So apparently during sort of like this period where they're dieting, or not necessarily dieting, but watching their diet and exercising, they've also ingested a lot more garlic, and maybe even garlic granules or garlic tablets, capsules. And apparently this has actually helped. So again, no studies have been done. There's no proof, but these are some of the claims. Some other things I've heard is some patients have said that they've also had red yeast rice, and apparently this actually helps with high cholesterol. So again, if you have tried these things, if you know more about these things, please let us know. Last but not least is ground flaxseed. So flaxseed is meant to be really good for you. That I know for sure. But some people have actually said that this actually helps with their high cholesterol. So if you've tried this and it works, please get in touch. And lastly is hawthorn. Go on.
I can see how flaxseed helped though, because I've tried flaxseed and I feel like it binds to like bad things in you, like fats and stuff.
In you.
So
and then goes through the liver, it's excreted. So listen, like some of these things, if you implement them on your daily, day to day, and they work for you, by all means keep going. Again, it's one of those things, we go via the science we read, and this is not really part of it, so we can't really say 100% it works, but if it does, by all means. And the last one I have is hawthorn. So some people say that hawthorn actually does help, but again, these are just claims, and we are going to go by the treatment we know, which is medication, and of course diet and exercise is all a stop. So those are some of the things that I have maybe come across or I've read that people have said works in reducing their low cholesterol.
I'm glad you actually mentioned that, because a while ago, like ages ago, my mum was actually diagnosed with high cholesterol, because she had like chest pain and stuff. And when she went to hospital, that's when they told us, stop the palm oil, all of that. And and someone actually told her, talking of home remedies, it just popped into my head. There's this, I don't know if you've heard of this thing, Benecol. It's like a yogurt kind of drink. Have you heard of it?
Yes.
Apparently that lowers like cholesterol. So literally, my mum was like buying loads and loads and loads of it. I don't know if it did help in the end, but she was literally going through it.
Interesting. I mean, to be fair, like even with some foods, if you think about it, some foods like even some spreadable like butters and things like that, when you actually buy them, it says there lowers your cholesterol. So there's a lot of things that is marketed as lowering cholesterol. Now, how true that is, we cannot really tell you. But listen, as long as you know what there is in this product and you know that it doesn't actually have high cholesterol, by all means, go for it.
That's right. So brilliant. What would be your take-home message for today's episode?
Right. So when it comes to cholesterol, we've come to talk about the high cholesterol and the low cholesterol, the bad cholesterol and the good cholesterol. So the bad cholesterol, as we've said, has no symptoms. There isn't
Yep.
anything to look out for. But without treatment, it can actually cause health issues. So if you're called in for your health checks, your yearly health checks, please go for these checks. If you're called in for your blood tests, for your blood checks, please go in for these blood checks, because a healthcare professional can actually help you manage high cholesterol if it has been diagnosed.
Yeah.
And in many cases, also this can avoid complications. So it's very, very important to know your cholesterol levels and to sort of like know this, earliest possible. And if you have done these checks, you can always ask your doctor if what your cholesterol levels are, especially if you're over the ages we mentioned. So if you're a male over 45 and a woman maybe over 55, you can always ask the doctor to test for your cholesterol levels and what these levels mean. But it's very important to practice a healthy lifestyle, exercising, not smoking, eating nutritious whole foods, and just smoking cessation, just things that you can actually implement on your day-to-day that are modifiable. It's very, very important to do this, because this is what will actually help manage your health and also your cholesterol. What is your take-home message, Steph?
Brilliant. That was fantastic summary of it. I love that. So as you've already mentioned, cholesterol is essential for all of us. But the only time when it's an issue is when there's too much of like the bad cholesterol, which can lead to the health risks such as like cardiovascular diseases, the likes of heart attacks and strokes. So as you mentioned, high cholesterol has no symptoms, and so regular screening is key. Small lifestyle changes can really make a long and big difference for your heart health. So make sure that you're doing the lifestyle changes, the diet, the exercise, quitting smoking, which can all help lower your cholesterol naturally. If needed, we do have medications which your healthcare professionals will talk to you about. So the likes of like the statins can help control cholesterol levels. But all in all, the big thing I will say about this is lifestyle. That is the most important thing. So take control of that and take control of your health. So if you enjoyed today's episode, please like, share with a friend, share with anyone, and subscribe for more health tips.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.